intubating these patients, the only drugs I need to use are ketamine and rocuronium. The rocuronium is not something that we're going to debate today. Just for completeness, when you're dosing rock, go full dose rock. You never want to underdose your paralytic because it's going to take a longer time for that medication to take full effect. I would like my paralysis to occur in 1 minute. The reason why I like ketamine is because it's very hemodynamically stable. And while I personally believe it is the best drug to intubate somebody who is overtly sick or subclinically sick, even ketamine can cause hypotension. And so it's not so much about picking ketamine as the single drug you're going to use every time. You're not going to use the typical dose of ketamine, 2 milligrams per kilogram. Even at this dose, you can get hypotension. When it comes to ketamine, I ask for full dose for 2 milligrams per kilogram, and we're going to resequence things just a little bit. So what I do, I'll either give half the dose first, or I'll even go with a quarter dose of ketamine, 0.5 milligrams per kilogram. We'll give that 0.5 milligrams per kilogram dose, and we'll wait a minute and see if that person has dissociated. If they haven't dissociated, well, then I'm gonna go ahead and give them the other quarter dose. Now we're up to 1 milligram per kilogram. We're gonna assess the blood pressure, and we're gonna see whether or not the person has dissociated. Now, most patients who are sick are typically good at this dose, but on occasion, you'll have to give a little bit more. And then once that patient dissociates, you're gonna go ahead and push your full dose paralytic. The reason why this works is because when patients dissociate, they're in the place that you want them to be in. They can't get any more dissociated when you give them more ketamine, but what can happen is the additional doses of ketamine can cause hypotension in that patient. The one thing you have to remember, because you're not giving the full dose of ketamine, this can wear off faster, so you have to be very quick about your post-intubation analgesia and sedation. But I found that using this approach to intubating my patients has led to less hypotension and cardiac arrest. We'll talk a little bit more about this and other cryptids. Thanks for watching.